every patient we can help, we will do.
We all know diabetes causes a lot of complications, ranging from retinopathy, which affects the eye, and then nephropathy, which affects the kidney, and then neuropathy, which actually affect the legs and the arms and stuff like that. So if we're able to have the sugars controlled within normal limit, obviously those complications could be minimized. And one of those complications is the neuropathy, which causes the amputations of the legs and stuff like that.
VM International.
Eat less sugar. So less sugar, like when you have coffee, don't put 4 or 5 spoon of sugar in it, but just try 1 spoon.
Atato mandia diabetes la kurangoto woto kamala ni be sukuro kele fofen kono fofen ni sukuru ma fen olomo na tare ka dosa lulle keje dosa kilin keje.
Gambia being a poor community, and then we don't have a well structured healthcare system.
What can I do to help the people in the Gambia? Because we love the country and we love the people here.
Aketa kuran ntimi alon kay mul batandi dunia kono bake sako Afrika. Mbakele kansilo bela docteur lu bakele kan. Yela kisikisiro lu kele. Yela jibero lu ke. Inata nyinje ko mul se sukuro tala.
But I was told that even our rice also have sugar. Is that right?
Yeah, but what can you eat then? Because when you say no rice, everybody said, well, what shall I eat? So I have a problem. So rice is not the first problem. The first problem is the
sugar.
The sugar. Yes.
Anim fanang ikana domoroke doro yekidiete la. Ika balabo nyoto kulike. Ni mamboroke no. Ise balobo nyoto bonyala. Abebe te atala kanyin kuran kelele. Ise balabo nyoto ke balo se mamau. E kana tara lara on manto de. Ka fo kon ke bayata le wato do bi je katama tamambang. Bari ale so katama isingo be bulu. Hani mambori bari se tama janke. Ye manghani kuran wala diabetes. Muna manghani sazala tonya manghani kurola diabetes alamanna tangala.
You can watch it anytime on a VM International. Dunia bi ala lamoy aliya follow from Facebook to YouTube.
Always like, comment, subscribe, and turn the notification bell only on YouTube. Don't forget to like our Facebook page, VM International.
Jaiteh Kaba komo yurwata le, baba komo yurwata. We dunia sidia dunia nganya dunia taman baba Jaiteh Kaba. Atofo Musa Jaiteh leti, bimbo la ne mokono. O baba Jaiteh Kaba. Wole musuma mbaro kimaneti. Wombaro kimane ay dulule soto baba bala. Di woro. Adim folo e ba mala ninjete. Adim folo nyaw ko e ba jere jete. Adim saba nyaw ko e baba e barato fo Mustafa ta. O baba e jete wole mumuti. Ousman Jaiteh Kaba. Adim me ba fala Omar tay jete. Omar tay jete boto wole bala. Omar tiyam jete abarika. We dunia site ay dunia nganya ay dunia tamang. Matida mane wala mali momati. Muna baba komo yurwata. Alanga komo yurwata. Muna baba komo yurwata. Jaiteh Kaba komo yurwata le. Baba komo yurwata.
Wow, thank you so much for that wonderful traditional kora and then the griot. Thank you so much. You really try. Once again, welcome to VM Show. It's all about educating and informing the general public here in Gambia, Africa, and the world Today we came to Kartong simply because we have seen something amazing, and this is a very big initiative from some of the people that you are seeing here on the ground. They are going to do the introductions, and they are going to tell us the name of the foundations that we're having here. Wherever you're watching, please kindly share this video, and do not forget to comment below the video by congratulating some of the young individuals that have come collectively to support a community called Kartong Village. But although they are not only supporting the people from Kartong, they are supporting the people of Gambia and across the globe. So what we're going to do, we're going to start the introductions. Then from there, we're going to tell you the reasons why we're here. Introduce yourself to the people. Tell us your name, and then where do you come from?
Yes, I am Joyce. I'm from the Netherlands, and I was here. This time is the 12th time that I am in the Gambia. I was here 10 times before for holiday, and last year in January 2024 I was at the beach, and I thought, well, what can I do to help the people in the Gambia, because we love the country and we love the people here. So I thought about it, and then I visit a hospital in Banjul, I visit EDC clinics, Lemon Health Center, a lot of health center and clinics. I talked to a lot of people here, and I am a medical pedicure, so I'm a specialist in food problems, especially for diabetic food problems. So I thought about it, and I was going back to the Netherlands, and then I thought, well, how can I help? And I had 3 colleagues of me, and I said, what can we do? So we come together in the Netherlands, and we made flyers for prevention. We made education for the nurses and the doctors in the hospital, in the university, and we did a lot of prevention to help the people here.
Thank you very much. I appreciate it. We'll go down to the professor here. He's a doctor, but he's going to introduce himself and tell us the reason why the people are gathering here. You're welcome.
Thank you, VM. Actually, my name is Ousman. I was born and raised in this community, and I left for United States in 2004, and that's where I got my education and everything. But we set up this foundation about 4 years ago, and we thought setting up a foundation would be an opportunity to kind of bring the entire Jaiteh clan together. And we've had about 2 reunions, and this is actually our 3rd edition. And we thought this time around we actually need to give back to the community that actually did a lot to a lot of us, and that made us who we are today. And that's one of the reasons why we came up with an initiative today to have the reunion alongside with a health fair. And the goal of the health fair is basically to target a metabolic syndrome, which includes diabetes, hypertension, high cholesterol, and obesity.
Yeah, but now tell us exactly what really motivated you people to do this, because we believe that government could have come in, we believe that the NGOs could have come in, but you people are not NGO, but you have just decided to come up with this initiative to support your community. What really motivated you all to do this?
Absolutely, that's a very good question. One of the reasons why we were motivated to do this, because if you look at Gambia, recently there have been a lot of cases of stroke and heart attack, and if you look at our goal for the health fair, we wanted to make sure we target the metabolic syndrome, which is diabetes, hypertension, high cholesterol, and obesity, which are the leading cause of stroke and heart attack. So we thought if we were able to address those issues in our communities and having treatment plan for those that are affected, then we will be able to reverse the cause of stroke and heart attack within these communities.
That's right. Now we come back to this expert. Tell us, what is your expertise when it comes to your work as a doctor?
Yes, I'm a doctor in specific in diabetic food problems.
Okay.
So like the problems they have, it's because the education about prevention, about how can we prevent to not cut the leg, to have no that is what it is.
Tell us exactly what really motivated you to come and join Kartong communities to support them with health cares, giving them medical support or medical advice, which are very important. What really motivated you?
Yeah, well, I live in the Netherlands, and Dr. Ouz lives in America, and they are countries that are well educated. We have everything we need, and I think the Gambia needs so much more than it is now. So I thought, well, if I am happy, healthy, and I can help anywhere, then it is here. So it's from a good heart to be volunteer here and to take a lot of people over here to volunteer every time. So I'm 4 or 5 times a year I will be here in the Gambia to work as a volunteer together with my team in hospitals and also here in Kartong. Yeah.
That's fine. Now we have seen a huge number of Gambians have come out. More than hundreds have been here, and we are expecting more people to come. How did you manage to have these numbers?
Yeah, we want to help everybody, but that's difficult because we are just with the 4 of us, and there are a lot of people here. But no help. That's not the issue. That's not the solution. So it's just a little thing we can do, but we do it from our hearts, and it's better than doing nothing. So everybody, everyone, every patient we can help, we will do. So that's it.
Tell us, what are the challenges behind helping the people in the Gambia?
I think the most of it's education. It all starts with education and awareness. What is a diabetic? What can you do for yourself to have good food? To have good possibilities to come to centers, health centers. Yeah,
that's fine.
Yeah.
So, ladies and gentlemen, watching us live, wherever you're watching. Just to let you know, this is a very good initiative for the people of the Gambia, because we are aware that many Gambians are struggling a lot with hypertension, diabetes, kidney failures, you name it. There are a lot of things that are really affecting people, and most of these things are caused either by what we eat or what we consume. So now we're coming back to you. Tell us, since you came up with this initiative, what are the challenges that you've been facing with some of these Gambian patients, that are really affected?
Yeah, so at this point in time, we have not diagnosed anybody with diabetes yet. The approach we're taking is basically we have a large number of people here that showed up for screening. So I also had a lot of volunteers from all corners of the country. So the approach basically would be we are going to do a general screening by checking random blood sugars on everybody. So those with high numbers would actually, I'll select the first 10 high numbers. Then those 10 numbers, I'll have their hemoglobin A1Cs checked. So once we have a confirmed diagnosis of diabetes, I've also made some arrangements with a pharmacist called Global Innovrex. So those folks would be supplying them with a 6-month supply of medications. And then right after 6 months, we're going to check their A1Cs again to see where their numbers are. And if they still have diabetes, then we're going to continue with medication supply as well. Then after 1 year, 2, we do the same thing. But those that say along the line have normal sugars and everything and A1Cs, then we'll have to employ what we call dieting and exercise management to kind of help them cope with their diabetes.
Now the question is, do you think this foundation is going to continue helping the people in Kartong and the Gambia?
Well, this is here to stay. I would emphasize that to you. And the goal is, this is a pilot program for now. We're only targeting 10 people, and this would give us an opportunity to kind of structure the program. But our goal is basically to expand it to a lot of people in the community. And as I said earlier, it's a pilot program and it's only targeting 10 people. And once we're able to have that well structured, then we're going to expand it.
Okay.
And we're not going to stop at diabetes. We're also going to target high blood pressure, high cholesterol, and also obesity.
That's a great idea. Do you have anything to add on that, what Dr. Ousman said?
Yes, I think spending is most important because you can do it local, but it's more important that the more the people are aware of it, the more the people can help, the more people have education.
But why did you people choose Kartong instead of other regions?
Excellent question. We all born and raised here pretty much, and the Jaiteh clan is in Kartong here, and then this association is also in Kartong here. So we felt that the community has actually done a lot for this, for our clan, and this is our turn to give back to the community.
Okay.
As one of this health fair is one of those steps we've taken to give back to the noble community that meant a lot to all of us.
That's right. You've been here for more than 8 years.
Yeah.
And you said you've been traveling, seeing different hospitals in the Gambia. What are the things that you have seen that really touches your heart and you want to make amendment on those areas?
There are a lot of amputations, and I think when you are aware and when you have more information, you can prevent amputations. Yes.
As we all know, diabetes causes a lot of complications, ranging from retinopathy, which affects the eye, and then nephropathy, which affects the kidney, and then neuropathy, which actually affect the legs and the arms and stuff like that. So if we're able to have the sugars controlled within normal limit, obviously those complications could be minimized. And one of those complications is the neuropathy, which causes the amputations of the legs and stuff like that. So this is why Gambia being a poor community, and then we don't have a well-structured healthcare system, we thought primary care should be the approach here instead of waiting to have a chronic condition addressed. So this is one of the reasons why we thought we control diabetes as much as we can to minimize the complications that would result to amputations.
That's right.
Yeah, they really touched my heart, and I want to give something back to the people.
We came here because we want to save your life, and we can only do that by spreading a better information. If we spray a healthy information, it simply means you are healthy. It simply means you can do better. It simply means you can work on your hygienic and the food that you eat in. It simply means you can control. Apart from sugar, what else should we be careful of when it comes to eating the food that we eat in order to stop diabetes in our system?
It starts with the children. Most children have the little bags with the sweets in the
ice cream.
Yes, ice cream and candies, and just a little less. Not the whole day, and not whole day soaking on this the little sweetness, but less.
Yeah, but some also have this notion that diabetes is not caused by sugar, because there are some people that have been eating sugar since they were young until they are old.
Yeah.
But people believe that it is a disease.
Yeah.
What is your take on that?
Yeah, I think human body needs pretty much a bit of everything. So I think we just have to minimize the level at which we take. That's one way to go about it. But in addition to that too, that's what we call exercise that goes alongside with that. So say for example, if you think you have a family history of diabetes, or you tend to have signs and symptoms of high sugar, basically before you see doctors, you should employ what we call dieting and exercising. So there's a saying that says you use it or lose it. So pretty much exercising, in as much as you're eating on your own and it's not controlled or it's not monitored, or you are not on the doctor's advice, if you're eating on your own, then you should also have that alongside with exercising. This would go a long way in terms of helping minimize you having diabetes as well. But take basic minimal amount of everything that your body needs, but alongside with an exercise. And if you feel like you still have symptoms of diabetes, you can seek medical attention.
Thank you very much. Now, can we have our Girio? Let's go like this, huh? Let's do it like this.
Ninda diabetes courant. Aketa courant nti mi alon kay mul batandi dunia kono bake sako Africa. Mbakele kan silo bela docteur lu bakele kan. Yela kisikisiro lu kele. Yela jibero lu ke. Inata nyinje ko mul se sukuro tala. Sukuro nyin ateto mandia diabetes la courant to. Woto kamala ni be sukuro kele fofen kono fofen ni sukuru ma fen olomo. Na tare ka dosa lulle keje dosa kilin keje puri la jata kende akamala anim fanan ikana do moroke doro yekidiyete la ika bala bo nyoto kulike ni mamboro keno ise balo bonyoto bonyala abebe te atala kanyin courant kelele ise bala bonyoto ke balo se mamma e kana tara laran dam manto de ka fo ko nke bayata le wato do bije katama tamambang bari ale so katama isingo be bulu hani mambori bari se tama janke ye manghani courant la diabetes muna manghani sasala tonya manghani courant la diabetes alamanal tangala nyin courant la nyin musasa jawbalti diabetes yangana jamale mandi doluni singol wulu tay wul bali singola dolni bulo wulu tay wul bali bulo la diabetes le nyi sabu dunia wala na docteur Ousman Jaiteh ana do nyolu yenye ko nyin docteur Ousman Jaiteh wulu ta Kartong janne iko momo ka fa la borle tewo wala na nyinje ko bira na ta jangala na manke kensen ketide ay docteur ol be inform ay mol bendi ako pour ka nyin sa kele amandang akun kilo dam manna docteur ol mate in America asa no la na la lundo siya na la holiday la barako hani bata Kartong na fa Gambia na fa mati da mane kema Mohamedou Fama Abdulaziz Fa Yusuf Fa Safia Fa wolum to nyati mfa martiyam Jaiteh boto wala bala o mfa martiyam Jaiteh boto baba Jaiteh le bala o baba Jaiteh wala boto baba Jaiteh bala baba Jaiteh to fo Mustafa lati atolum baba Jaiteh din sabanjawte mba aroki mane wala ya wulu Jaiteh kaba konkombali kaba katibali kaba bosi bali itele musumam mati da maneti matida konte jula sankaranka dukuni mbala fakanta ngana anin tawla jong wo matida konte wala ni adama ni hawa wuluta wo adama ni hawa henan America no sole mati in America matida konte jula ni ajente bi jambi ala nite asababu tetella itelenje ye nanan Ousman ya Jaiteh kaba konkombali kaba bosi bali kaba katibali Ousman Jaiteh ise la dunia siti ya dunia nganya tele ning hata buluta ini mutaru buluta ini tijanu buluta woti jani abe siri min tol America siato tele tijani sabuje Jaiteh kaba konkombali iba ma ba volele mba mati da mane nyencho musole wulu ise dunia siti ya dunia nganya dunia tama America manku yela mumeke ye nanan Ousman ya Jaiteh Namu.
Adi telepon enta.
How are you? What's your name? Joyce ni ulara jali ala ni sumungaira la Joyce. Isa dunia sidi dunia nganya Joyce. Na dalan kumo mankuyela mumeke Joyce abarika. Nyabra Joyce fe animfadu ale jabita wasidukum danankum ya sidukum. Wallahi. Dunia sidi dunia nganya dunia tama Mrs. Joyce.
Abaraka bake. Thank you so much. Finally, Jali, ya abaraka bake. Jali nyumuy talti. Mbadi ngolu ñinan Jali yala diati. Eko kibaro tolka kibaro di wadon tolka fo nyamen ka ngani wotole. Bal jalol wolka ajol comme ning dimba kandering. Ye jo wa ay sumaya jalol ko wala nan ka fo telefon mun jali li solti bar mba fo le telefon ya barka bake atol me alon ko le yin kibaro lo moy for those of you who came across this information we are telling you make best uses of this time to take care of your health and of course do some exercise. If you are not doing nothing at home, try and do some exercise either by running, walking, or either exercising to walk from one place to another. It's going to help you. We are here to help you. But again, we're here to help ourselves. In as much as we are giving you advice, the same advice is coming back to us because we're doing that every now and then. So now what we're going to do, like I asked her, what is your greatest message to the people? She said she's going to think about it. So tell us your greatest message to the people and we say goodbye.
Yeah, so the greatest mission, what is very important, is to check on your feet. To always check your feet every day, to look if it's okay or there are wounds or something, and to reduce the sugar. And I hope to see you all, meet you everywhere in the Gambia. Thank you.
We really appreciate it, ladies and gentlemen. If we come to this time, we will thank you for watching, and then thanks for taking your time to at least pay attention to us. Hopefully in the future it's going to benefit all of us. So wherever you are, take care of yourself and look at your feet daily or every single moment. So when we come to this point, we're going to say thanks for watching, and we also thank the Jali for joining us and for making this day a wonderful moment for all of us. Thank you so much for your voice, and that we really appreciate it. God bless you.
Dunia bi ala la moy alia follow from Facebook to YouTube.
Always like, comment, subscribe, and turn the notification bell only on YouTube. Don't forget to like our Facebook page, VM International.